Hi, everybody. This week we are talking about delirium. Caregivers are asking about delirium. Why does mom or dad all of a sudden seem so mentally confused? What causes delirium, how to manage it, and what might be some potential short and long-term solutions? Delirium is common among older adults who have a diagnosis of dementia or Alzheimer's, those who frequently have urinary tract infections, a serious illness like cancer, a heart condition, liver failure, anyone who has ever had a seizure, and even seemingly healthy adults whose electrolytes, which means sodium, calcium, magnesium, and phosphates, are out of normal range, or even an aging parent who is dehydrated. Low blood sugar, thyroid problems, and some medications also cause delirium, which is why delirium can be so difficult to diagnose and to problem solve. So stay with me while I share some examples and stories about my clients who have experienced delirium and what caregivers can do to help their loved ones experiencing this frequently underdiagnosed condition that can lead to major health challenges for loved ones. I'll answer the question about what delirium looks like, why it should be treated very quickly, what you can do to prevent it from recurring and causing other health problems. I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker with more than 20 years of working directly with older adults, caregivers, and patients, and disabled people, which means parents who are caring for disabled children and disabled adults who grow from childhood to adulthood and have a lot of health conditions. My website is PamelaDWilson.com. I ask you to please click below, like this channel, like this video, follow my video, and please comment if all you do is say, hey, thanks for the video. Your participation helps other people find over 800 videos on my channel and a lot of free, helpful caregiving information. So let's answer the question of what delirium looks like. Delirium often shows up suddenly, out of the blue. Yesterday, mom or dad were doing great. They were out in the yard. They went to the grocery store. They did a lot of things. And all of a sudden today, they have difficulty focusing their mental attention. They can't follow a conversation. They can't have a conversation. Their words don't make sense. They're not completing full sentences, and they may physically not be able to get out of bed or even stand up. Some aging parents even hallucinate. They see things that aren't there, or they have delusions believing that someone is trying to harm them or somebody in the family stole something. The bottom line is delirium is scary. It's scary for the caregiver, and it's scary for the person who's experiencing all of these changes, and they're trying to figure out what's going on, and the caregivers are trying to figure out what to do. An example of this is a client that I visited who was perfectly normal one afternoon. The next day, my office received a phone call from the staff saying that the client needed a wheelchair because he couldn't get out of bed, and he was mentally confused. So since he was doing well the day before, I asked them to do a number of diagnostic procedures, simple things that you can do yourself. I asked him to take his temperature, take his blood pressure, take his pulse oxygen level. I asked if he slept well last night, if he drank, was he dehydrated, did he use the bathroom? And what I discovered from all of these little questions and measurements was that his blood pressure was low, he had a temperature, and his breathing rate was low. So we sent him to the emergency room where he was diagnosed with pneumonia. My client didn't need a wheelchair. He was experiencing delirium, which indicated a more serious health problem. And if they hadn't called that morning, 6 hours later, 8 hours later, my client could have been dead because that infection could have proceeded so very quickly that it took his life. Fortunately, he was sent to the emergency room. He was treated for pneumonia, and sent home and lived another 2 or 3 years. Time and being sensitive in treating any type of change in health condition, especially delirium, is important, because if there is an underlying infection causing this, that infection can rapidly get so much worse. So the what to do about delirium is to take it seriously, to do some measures if you have a blood pressure machine, if you have a thermometer, if you have a pulse ox machine. Go to the emergency room, call 911, get your loved one into medical care as soon as possible. And the other thing is, never send a person experiencing delirium or delusions or hallucination or a person with memory loss to the emergency room alone, because they cannot explain to the doctors or the nurses what's going on. They can't explain how I was different yesterday and how I'm having all of these problems today. People with memory loss and those experiencing delirium need an advocate who can speak for them. Now, how does delirium happen? What are the causes? I talked about a couple of them, which are infections. And in many cases, it is an infection, like a urinary tract infection, bronchitis that turns into pneumonia, or another infection. In others, when the issue's not obvious, right? The hospital will run blood work. They'll look at electrolyte levels. They'll look at red blood cells, white blood cells. They'll look for an infection. They'll look for nutritional deficiencies or something else that might be going on in the absence of something that is not obvious. Because sometimes the cause of delirious isn't obvious. You've got to hunt for it. You have to search for it. You have to examine things through trial and error and try to figure this out. And this is where you as the caregiver are extremely important. You know what your loved one is like on a good day, and you know what your loved one is like on a not so good day. What are the differences? What happened differently? Did they not eat? Did they not drink? Did they start to feel poorly? What changed? That is critical information for doctors. And the complicating factor is here, delirium can come and go in a matter of days. One day your loved one is confused, they can't speak, they're having hallucinations, and the next day, or 2 days later, they're almost back to normal. So it's this night and day type difference that is hard to track down. In my experience with my clients over the 20 years that I was a care manager and a professional fiduciary, there were a lot of things that me and my staff would look for as the cause of delirium. One of my clients frequently experienced mental confusion associated with delirium, and it was caused by dehydration that caused her blood pressure to drop. So whenever this happened, we had a note in her chart, we had a note in her file, the minute she's experiencing any type of mental confusion, give her something to drink, give her water, give her a protein drink so that she becomes less dehydrated, becomes hydrated, and that low blood pressure resolves and it comes up. We also suggested that they take her blood pressure right away so that they knew how low it was, and then kept filling her with fluids until the blood pressure rose to a normal level. And we gave them what a normal level was, because caregivers are not doctors. Many caregivers are not medical personnel. They need direction from family caregivers or somebody else. Now, another condition that can cause delirium is people who have diabetes. Their blood sugar drops. Mental confusion, they're sweating, they're dizzy, they're feeling anxious, they might be shaking, they might have a rapid heartbeat. If you've ever had a drop in blood sugar, even if you're not diabetic, you know what that feels like. It doesn't feel good, and you can easily become mentally confused. Any type of infection can cause delirium and proceed to a condition called sepsis, which is a very serious and life-threatening, life-ending infection for the elderly. Sepsis can be identified by fever, by a rapid heartbeat, by sweating, feeling lightheaded, and a drop in blood pressure, most often related to some type of infection. So it's prudent, if your loved one has these episodes where they're not feeling well, Pick up a blood pressure monitor at the drugstore. Make sure you have a thermometer. Go look for a pulse oxygen product. It's a little thing, it's like a clip, and it goes on the finger, and it measures how a person's breathing. Now, normal people have pulse oxygen levels that are, 97, 98, 99. They get into low 90s, that's a danger sign. And if they're in the 80s, that's really, really low. You've got to do something. Other things that can cause sepsis are, a cold that quickly goes into pneumonia, somebody who has stomach or digestive issues, a serious wound, a burn, a catheter that's not cleaned can cause an infection and sepsis. If your parents, your mom or dad, your grandparents, whoever you're taking for, are elderly and they have one or more chronic diseases, so chronic diseases like heart disease, diabetes, breathing problems, asthma, COPD, cancer, chronic diseases can result in delirium. So diseases like diabetes, kidney disease, anybody who has a weak immune system who, is around somebody with a cold and all of a sudden they catch the cold and they don't feel well. Those people are more susceptible to infections and to delirium. And I'll share another story because this also proves that even if your loved ones live in a care community, maybe independent living, assisted living, memory care, or even a nursing home, the care staff who is not as familiar with them as you are can make assumptions based on their experience. They can make mistakes. So one of my clients permanently lived in a nursing home because she had a lot of complicating health issues. And one morning I received a call from the nurses saying that my client was seeing and talking to her dead husband and her dead son. And so to the nurse, this meant that my client must be actively dying and she's hallucinating and she's talking to people on the other side. Now, this was based on that nurse's experience with other people, not my client. So the nurse did not want to send my client to the hospital to be diagnosed. She wanted to call hospice in and let my client die. And so knowing my client way better than the nurse and the nursing home staff, I said, look, you are either going to pick up the phone and call 911 and have her taken to the emergency room, or I'm going to do that. Because I can tell you, based on my experience and my knowledge of her, all the years I've taken care of her, she has a urinary tract infection. So what happened? She went to the hospital. She was diagnosed with a urinary tract infection. She was treated and she was fine. She was not actively dying. These are the risks and the blessings, right? Because there's good and bad of having other people involved in the care of your loved ones. If you don't stay involved, if you don't put in the chart that you must be called about any changing condition, that staff can make a decision that would contradict what you would do, and your loved one can have a serious health issue and pass away. None of us want that. So as you can see by these stories, care staff and care communities are not always properly trained, and maybe they don't have the level of experience that they need. Maybe they have past experiences or biases or opinions about what is happening because of their experience with other clients, not your loved one. And so they may not always respond appropriately, or they may give you recommendations that just don't make any sense. The first course of action for you for this is to place a note in their chart, in their file. Tell their staff, tell everybody. They are to pick up the phone and call you immediately upon a change in condition. This does not mean they're calling you 2 hours later, or 6 hours later, or 12 hours later. That could be too late. The only time that you don't want them to call you is if there is a very serious condition like a heart attack or a suspected stroke. In that case, they call 911 and then they call you so that you can meet your loved one at the hospital. Honestly, there were so many times during my 20 years of managing care for older adults and patients that I was on the phone talking to 911 while they were picking up my client from their home or an assisted living community or a memory care or a nursing home, with me telling the paramedics what's usually going on so that by the time they get to the hospital and the paramedics transfer the individual to the doctors there, They have a good story to tell about what we think is the problem. And then, of course, I was always in the car, or my staff was always in the car on the way to go to the emergency room to meet the client, because you don't leave someone alone in the emergency room who can't explain what's going on. So as we talked, a lot of conditions can cause delirium, including too many medications. Pain medications can cause delirium. Any medications that can affect brain function. And sometimes these include medications that are prescribed for people with dementia or Alzheimer's because they have anxiety or depression or behaviors. So medications that go by the name of Seroquel, Xanax, Ativan, clonazepam, haloperidol, and others, these can cause delirium. So those also have to be eliminated as the cause. Older adults with health issues can be very, very sensitive to medications, especially if they're taking more than one medication. 2, 4, 6, 8. The more medications that a person is prescribed, the more likelihood is of having multiple side effects. And sometimes, this is going to sound crazy, but a person is prescribed a medication that has a side effect. So what does the doctor do? They prescribe another medication to take care of the side effects that the first medication caused. Have to watch out for that too. So how on earth do you manage all this? What do caregivers do if a loved one has experiences of delirium and they're treated and then they have another episode of delirium and it just keeps happening and happening and happening, which can happen? The first thing is try to understand that delirium can happen at any time. And again, kind of like I mentioned before, it's kind of watching your loved one on a good day and a bad day and what the difference is. Now, if this keeps happening, then I recommend documentation. Get a notebook. Monitor their temperature every day, their blood pressure every day, their pulse oxygen. Monitor what they're drinking. Are they eating enough? Did they sleep well? And if your loved one doesn't have advanced dementia, they can help you with this documentation. You can give them a job, right, to help them stay out of the hospital. Nobody wants to go to the hospital. Nobody wants to go to a nursing home if they live in a private home, right? Even if you live in assisted living, you don't want to go to the hospital or a nursing home, right? Now, if your loved one has dementia, then you or another person is going to have to keep this documentation. And the benefits are significant because they can help you identify what's going on. So things to document, questions to ask yourself. Nutrition. How much are your loved ones eating? And of what they are eating, are they getting enough protein? Do you need to supplement with something like Ensure or MedPass or a Mighty Shake to make sure they're getting enough protein to sustain their weight? Have they lost weight? Are they drinking, and how much are they drinking? Older adults, especially women, don't like to drink because then guess what? They have to go to the bathroom. Well, what I tell people is getting up to go to the bathroom is exercise, and you need physical exercise to stay strong and healthy. So drink and go to the bathroom. Don't make a big deal about it. Are your loved ones eating meals at regular times a day, or do they maybe accidentally forget to have lunch or forget to have breakfast? Consistent nutrition is very important for older adults because over about 50% are malnutrition, even though you would never know by looking at their body. That is usually identified through blood tests. Other things that can cause confusion. If your loved one has a hearing problem, are they wearing their hearing aids? If they have vision problems, are they wearing glasses? Do they wear dentures so that it's easy for them to eat? How are they sleeping at night? And are they sleeping at night and staying awake all day like most of us? Or if they have dementia or Alzheimer's, are their days and nights reversed? There are ways that you can work back out of that and keep them awake during the day so that they sleep at night and you sleep at night. Is the house quiet? Are there no annoying noises like some buzzer or somebody playing on the computer that makes a lot of noise that can be disorienting for an older person? Or is there a loud appliance like the refrigerator makes a lot of noise, or a television that's loud? All of that stuff can be very disorienting for a person who has dementia. Consistency in a daily living environment and care is so important for older adults. So as you document, make note of anything you notice that's unusual or just not right. It may not make sense today, but it may make sense a couple days later if delirium shows up. Are your loved ones going to the bathroom okay? Are they urinating enough? Again, if not, they're probably dehydrated. Again, take their temperature, take their blood pressure, use whatever tools that you can. Because the more factual information you can provide to doctors, whether it's in a doctor's office or an emergency room or an urgent care, the easier it's going to be to potentially identify the cause of this delirium and to figure out how to stop it from happening again and again and again. Now, separately, your loved one could go to the hospital emergency room for something else and not have delirium. And then they're in the hospital and all of a sudden, guess what? They have delirium. This happens. Delirium frequently happens for older adults during hospital stays. It's also common in loved ones who permanently reside in nursing homes. The risk is it's difficult to diagnose, especially if your loved one lives in a nursing home and you're not there 24/7, which obviously you cannot be. So then you have to be the person who starts asking questions. What's going on? Are you guys taking blood temperature? Do they have or blood pressure? Do they have a temperature? Do they sleep well? What is going on with my loved one? So elderly who go into the hospital who have delirium, either on the way in or when they're in there, the longer they're in the hospital, the more likely they are to experience delirium for a number of reasons, right? People who go into the hospital are sick. There's sick people in the hospital. Your loved ones can get more infections and illnesses from other people while they're in the hospital. I know that sounds counterproductive, but it does happen. The other reason people experience delirium is they're out of their normal environment. Loved ones who have dementia or Alzheimer's, and they wake up in a strange place and they have no idea where they are. And you're not there. There's all these strange people there. And they may be hooked up to machines, right, that are beeping and buzzing. And then the hospital's care staff has to come in every 4 hours, 24 hours a day, wake them up while they're sleeping and take their vitals. That is very, very disruptive. Even if you're a 30-year-old and you're in the hospital, it's disruptive for you. Imagine what it's like for somebody who's 85 and they have Alzheimer's or dementia and they have no idea what's going on. Very disorienting. Sometimes hospital rooms don't have windows, so your loved one may not even know, is it nighttime? Is it daytime? Should I be sleeping? What should I be doing? It's difficult, right? Hospital rooms and nursing home rooms also may not have clocks or calendars. What day of the week is it? What time is it? If your loved one is able to follow through with that information, right? It's almost like you're taking somebody out of their normal routine and putting them in this room, which is a box with nothing familiar, no familiar people, things that are making noises, people that are coming in and out. So as you can imagine, that can be pretty disorienting. So when loved ones return home from the hospital, get them into a normal routine as soon as possible. Quiet house, meals at the right time, fluids, exercise, everything. And while it's really impossible to predict what can happen in the future, your loved one may have delirium and may never have it again. Or they may have delirium and every week they're having another episode, right? It's the small details, noticing the small details and their daily activities and documenting this. This gives you more opportunity to help medical professionals figure out what's going on so that your loved one can do better and have better health and maintain their health and not be going to the emergency room all the time or not having to go to the doctor all the time. All of your efforts matter. Documentation matters. Paying attention to the little details matters. I thank you so much for joining me in this video. I'm Pamela D Wilson. I am a caregiving expert, advocate, and speaker. Please, again, click below, like, follow these videos, like my channel, comment, if only to say, hey, thanks for the video, because it helps other people find help and support. You can also go over to my website, PamelaDWilson.com. On there are 3 free online courses: how to care for aging parents, information about power of attorney, and information about guardianship. I also have a podcast called The Caring Generation. I have a private online caregiver support group on Facebook called The Caregiving Trap, which is also the name of my book. There's a lot of free information here for people. You can also go to my website and click on the Contact Me tab if you would like to schedule a personal one-on-one consultation. Thanks for being here. I look forward to seeing you all again in another video.